Hi. So, in my last video, we talked about the ableist behavior of medical professionals, healthcare professionals. So, let us discuss about how the ableist attitudes among doctors can be addressed, how they can change themselves, what do doctors need to do, and it requires a multifaceted approach. So, dear medical professionals and healthcare professionals, please counter your ableist tendencies and promote inclusivity and equity in your practice. Here are some strategies for you to consider. The number one being educate yourself. Take the initiative to educate yourself about disability, disability rights, and the experience of individuals with disabilities. Seek out reputable resources, attend workshops or conferences, and engage in ongoing learning to challenge and update your knowledge and perspective. In this way, you would be able to address your ableism. Then examine personal attitudes and biases. Reflect on your own attitudes and biases towards disability. Consider how these attitudes may influence your interaction with the patients. Challenge any ableist belief or stereotypes you may hold and work towards cultivating a more inclusive mindset. Please try to adopt a person centered approach. Treat the individuals with disabilities as autonomous individuals who have unique strengths, experiences, and perspectives. Involve them in their own healthcare decisions, respect their autonomy, and actively listen to their concerns and needs. Try to use inclusive language. Utilize person first language that emphasizes the person rather than their disability, and avoid derogatory or demeaning language, and be mindful of the impact of your words that can have on your patients. Ask individuals about their preferred terminology or language, and do create accessible environments. Ensure that your practice is physically accessible for individuals with disabilities. Make necessary modifications to your facilities, such as providing ramps, wide doorways, and accessible examination tables. Consider the need of individuals with sensory disabilities and provide appropriate accommodations or aids. Then effective communication is must. Develop effective communication strategies to facilitate interactions with the patients with disabilities. This may involve using clear and simple language, providing written or visual information, utilizing assistive communication devices, or engaging with interpreters or sign language services whenever needed. Address implicit bias. Implicit biases are unconscious attitudes or stereotypes that can influence a person's decision making. So, engage in implicit bias training and self reflection to identify and address any unconscious bias you may hold. Seek feedback from colleagues and patients to gain insights into your blind spots. Collaborate with disability specialists. Collaborate with such specialists, therapists, and other healthcare professionals who have expertise in disability related issues. This interdisciplinary approach can ensure that patients receive comprehensive and holistic care. Try to advocate for systemic change. Advocate for policy changes and initiatives that promote inclusivity and accessibility in healthcare. Work with healthcare organizations and institutions to implement inclusive practices and policies that address ableism. And then listen and learn from individuals with disabilities. They can be your teachers in a way. Engage in open and respectful conversations with individuals who have disability to understand their experiences, challenges, and needs. Listen to their stories and incorporate their perspectives into your practice. So, by actively countering ableism and promoting inclusivity, you can contribute to a healthcare system that values and respects the dignity, autonomy, and well being of individuals with disabilities. By addressing ableist attitudes of yours and fostering a culture of inclusivity and respect, you can work towards providing equitable, person centered care for individuals with disabilities. So please do try to do so.